And now to South Africa, which has been battling to contain a mutant strain of COVID-19 that studies now show renders two types of vaccines from Pfizer and Moderna 60% less effective. The strain has now been found in more than 30 other countries, including here in the United States, prompting travel bans. But as special correspondent Chris Ochamringa tells us, across Africa itself, borders remain very much open, and there's little hope of getting enough vaccines for years to come.
Grave diggers find little rest in this cemetery in the port city of Cape Town. South Africa has recorded more than 46,000 COVID-19 deaths since the pandemic began, the highest number on the continent. And the toll continues to rise after the discovery of a new variant. Dr. Richard Mihigo of the World Health Organization.
WHO, we're taking this quite very seriously because from some preliminary data that are starting to emerge, it's clearly showing that the new variant is a force behind the new wave that we are seeing in many countries.
The spread of the new variant has prompted a raft of countries, including the US, to ban travel from South Africa. The UK has gone a step further, banning new arrivals from the Democratic Republic of Congo and Tanzania, amid fears the mutant strain is spreading rapidly there. At least 20 other countries, including the US, have also found cases. And while travel bans shutting South Africans out may help, borders remain open across Africa. That leaves countries like the DRC and others that are still open to flights from the rest of Africa vulnerable. And according to health officials like Dr. Kalubi Mulamba, the DRC has seen a spike in infections over the last 5 months.
This second vague of COVID, when it came, we have received many patients. When we can try to compare the first and the second, we can say that now we have received more patients than before.
Health experts here believe the rise in cases may be caused by a completely new variant.
We are still analyzing the samples, so it's possible that this variant is already in the country.
Identifying which variants are prevalent across the world is key to containing the virus. In that effort, the WHO and the Africa Centers for Disease Control and Prevention have set up COVID-19 genomic sequencing laboratories in the DRC and other African countries to help boost their capacity to detect the new variants.
We are, for the moment, asking countries to ship to these regional reference laboratory a minimum of at least 20 specimens of the virus so that we can be able to establish the circulation of the new variant as it has been detected in South Africa, but also in other several countries in Africa.
But the fact that people haven't stopped traveling among African countries, including migrant laborers and business people, means there is very little way of knowing how far the variant first found in South Africa is spreading across the continent. This Congolese family in the capital Kinshasa has a home in South Africa, and they're determined not to let the pandemic wreck their ability to travel back and forth.
I think it's a matter of taking responsibility, the sanitary measures. I'm not too worried about it as long as I stick to what I've got to do. You know, put on the mask, have your sanitizer. It's a wave, it's gonna come and go, so you just got to protect yourself.
We apply those measures and we are safe, so I trust them and I'm willing to travel because I have to go and visit my family. Yeah.
Not everyone is as relaxed. Some African countries like Nigeria are doubling down in their efforts to contain the new variants with quarantine rules for people coming from countries where they're prevalent. Still, borders remain open, increasing Africa's vulnerability in the absence of a meaningful vaccine rollout across the continent. South Africa, which was on the cusp of starting its mass vaccination program, suddenly and controversially paused the rollout of the AstraZeneca vaccine. Reports suggest the vaccine may offer only minimal protection against mild disease in young people caused by the variant. The research indicates that nevertheless, the vaccine does protect against serious disease, hospitalization, and death, And meanwhile, South Africa has announced plans to use the Johnson & Johnson single-shot vaccine instead. How South Africa recovers from stalling the start of its vaccine program is unclear. Even so, it's made more progress with vaccinations than some other African countries, where vaccine skepticism is compounding the problem. Tanzania's president doubts their efficacy entirely.
Ni lazima Watanzania tuwe waangalifu.
We Tanzanians must be very careful about receiving medical supplies from abroad. I am asking the health ministry not to be too quick to accept any vaccine without ascertaining its efficacy.
As researchers investigate ways to modify COVID-19 vaccines to tackle the variant originally discovered in South Africa, the Africa CDC has warned about rising fatality rates across the continent. And with more than 3.5 million coronavirus cases already reported in Africa, the continent is only now beginning to receive the first arrivals of COVID-19 vaccines on a wider scale. But the reality is there won't be enough vaccines for potentially years to come. And as borders remain open, the question remains, what's Africa's way out of the pandemic? For the PBS NewsHour, I am Chris Sochamringa in the Democratic Republic of Congo.
And today, in an effort to start helping to find that way out, the Biden administration announced that it would support a global push to distribute COVID vaccines equitably. It added $2 billion for the effort to ensure vaccine availability, adding to the $2 billion authorized by Congress last year.